Welcome to the So Tell Me podcast, where I talk with fascinating professionals about the work that they do. I am Dr. Melissa Deuter, and today I'll be talking with Dr. Michael Figueroa about his work as an intensivist. This podcast is sponsored by Sigma Mental Health Urgent Care, located in San Antonio and Austin, Texas. Okay, so Dr. Michael Figueroa. So I'm going to start with a story of how I know you, which is that we were interns together on internal medicine in the hospital. And there were just the two of us, I think, and a resident. And we were providing medical care to hospitalized patients. And so I was a psychiatry intern, but you rotate through these other specialties. But it was probably sometime in the winter, and I had done psychiatry first. I'd done inpatient psychiatry and outpatient psychiatry, and I think I did a medicine outpatient clinic. But I arrived to the hospital and I was terrified. And what I remember is you saying, "Oh, listen, it's no big deal. If you have any procedures, I need to get procedures. If you need to put in a chest tube or whatever, I'll do it for you." And I thought, "Oh, I've been saved. This is the best thing that's happened." And so that's my core memory of you as a person and us meeting. So then we were both interns together. Here I am. I'm in psychiatry, which it was already where I was. But can you talk about where you went and how you ended up doing what you do now? Like, just tell me.
Yeah, so I'll start with what I'm doing now. So right now I'm mostly an intensivist. So that means just working in the hospital, of course, all the time, working in the ICU. I think people now understand after COVID, like kind of what an intensivist does. But I did my training, of course, with you there in San Antonio, and I did fellowship training in pulmonary, critical care, and sleep. So I did all three fellowships
And is that
combined.
required to be an ICU doctor to
Not
do?
anymore. Not anymore. Initially, and of course, for those that don't know, you have to do internal medicine 3 years first, and then you can enter your specialty fellowship under internal medicine.
And let me just go back. You do college, 4 years of college, 4 years of med school, 3 years of internal medicine, and
And then
then
another three, almost 4 years of fellowship. So it comes out to about 15 to 16 years total for everything once you get out of high school.
yeah.
So yeah, so I did fellowship in all those three. Now, nowadays you can be an intensivist and you can be in multiple specialties. So even out of the realm of internal medicine, so you can be a surgeon and be critical care. So you can be like a trauma surgeon and get critical care certification to work in the ICU, but they tend to work more in like trauma ICUs. I I do pulmonary and critical care. I mean, sorry, pulmonary and sleep some, but really the majority of my work now, I've kind of gravitated to internal medicine. I mean, as you're aware, medicine has become so specific, I think, for everyone. And so everybody has kind of become these super specialists that even within a certain specialty, they tend to kind of gravitate to either something that you like more or that you feel kind of suits you better or that just works with your schedule. When I started, it was almost all the fellows that trained did both um, pulmonary and critical care together. Sleep was kind of like if you wanted to do it. Sleep was in very much transition. Sleep's more of a newer profession for medicine altogether. And so we had to do pulmonary and critical care together, and almost all fellowships required that. But now people will do critical care in ID, critical care in nephrology, critical care, whatever they want.
Yeah.
Um, and then we have some, like one of the doctors that works with me, he's purely critical care and he has no other internal medicine specialty. He's just critical care. That's his only internal medicine
Oh, yeah.
specialty. And so the reason that's kind of evolved is because back in the day, like when I first started, when I came out of practice, I had a pulmonary clinic. And so it wasn't uncommon that you would have clinic and you'd also be working in the ICU at the same time because the ICU doctors weren't always stationed just in the ICU.
Oh, yeah.
So it would,
I
yeah,
don't
it wouldn't
think I
be,
knew that. I mean, when I
yeah,
rotated through the ICU in medical school, the people who worked there seemed pretty stably to work there. If they had clinic, I don't think I knew that. They
yeah,
were
yeah.
just like, it's just such an intense, I mean,
Hmm.
it's intensivist because you have people, you're basically like medically keeping them alive sometimes, either after really bad accidents or they almost died from a medical condition or they had a major surgery, and you're, you know, I don't, you're, I mean, you know better than I do,
Yeah.
just tweaking all these meds up and down, trying
Mhm.
to keep this body alive so that healing can happen. And it's intense, not
Yeah. But
unintense.
yeah, I used to go, and sometimes you would round in the hospital in the morning, and then you'd go back and have pulmonary clinic, and then you'd go back and round in the afternoon. And so it was a very different model for critical care, not even, 15, 20 years ago. And so, I didn't like it personally when I first came out, because I came out about in 2007 was I finished, because I had an extra year where I was chief resident for a year for internal medicine before I started my fellowship. And so, um, they uh they would do that model, and I never liked it because I didn't find it very efficient. Because if a patient crashed, in like a patient needs to be intubated for respiratory failure while you're in clinic, you have to drop clinic, leave, go across to the hospital, take care of that patient, which may take an hour or two, and then you try to come back to clinic. But then by then, of course, all your patients are very upset for good reason. I would be upset too, and I didn't like it personally, because I didn't feel like I was doing good care to either side of the realm. I didn't feel like I was taking good care of my clinic patients. I didn't feel like I was taking good care of my hospital patients. So actually,
These were like the clinic, those were pulmonary cases?
uh-huh. Yeah, mostly pulmonary. And sometimes you would have ICU follow-up. So let's say somebody had a bad respiratory failure, were on a vent for like a month, or had ARDS. So you may follow them up to check PFTs to see, like, how's your lung function after you were through this big ordeal? Like, did your lung function come back to normal? Are you having muscular issues? Do we need to get outpatient rehab involved? So it'd be some of those, but it was a lot of pulmonary. Pulmonary is a lot of COPD, lung cancer. That's the big kind
Uh,
of bread and butter for pulmonary. And of course asthma, so like the obstructive lung diseases. And then of course you also have the esoteric, like rare lung diseases. And I did a lot of transplant and pulmonary hypertension patients
mhm.
too. So I had a really good varied, but it's really hard to keep up in all those specialties and be like the best in all those specialties, you know what I mean? And then, like, for lung cancer, bronchoscopies have gotten very advanced now. So now you can do endobronchial biopsies, you can do like 3D navigation bronchoscopies, all these techniques, and you really got to be doing them like all the time. So like if you're just in the ICU for 2 or 3 weeks because you're really busy in the ICU, you might not have a chance to do any bronchoscopies beyond the real simple bronchoscopies we do in the ICU. So you kind of, I don't feel like you're at your best skills doing that. And so I didn't like.
I think this is relevant throughout medicine. I mean, you just can't do it all and be up to date on everything. But then this ends up
No.
being a problem, right? Because people want to go to their doctor and have their doctor be their doctor. But
Right.
you can't be everything because it's too much information,
No. No,
especially
I mean,
procedurally and everything.
yeah, and the good thing is that, I mean, I can take care of pulmonary patients, and I can at least identify a patient and be like, "Oh, you're definitely a transplant patient. You need to go see a transplant doctor," and send them that way. So definitely we do have the skill set to help with that. But again, yeah, for your day to day, most people have kind of what I call have become like super specialists, where they just kind of focus on one thing. And so for me, it's really been critical care has become kind of my super specialty where I really enjoy. But it's really neat though, because doing like even sleep medicine, which you think, oh, well, that has nothing to do with critical care. It has a ton to do with critical care, because a lot of people have sleep apnea and they don't take care of it, and they go into atrial fibrillation. They come into the ICU with AFib with RVR. Their rate is really fast. They need to be on all these special medicines, IV. We got to take care of them. They can also have ventricular arrhythmias, even cardiac arrest in the middle of the night because of their sleep apnea. So for me, it's really cool because I feel like I can not only help take care of them in the ICU, but I can help identify things that are going to help them when they go home. So it's not like just I see them and I take care of the problem and like, all right, that's it. I'm not going to ever see you again. I can give advice to the doctors down the road and say, you know what, you really shouldn't give these patients these sleep medicines at night because they have bad sleep apnea, or they're obese, or they have heart disease. Really, you shouldn't be giving them a bunch of Ambien,
Yeah.
the extended release Ambien at night, because this person's probably going to arrest in the middle of the night one day. And so having that real global perspective, I've really enjoyed, because to be a good critical care doctor, you have to be a fantastic internist at baseline. That's what, to be a good critical care doctor, you cannot forget. And as you've seen, like in a lot of the internal medicine specialties, It's a little bit, that's kind of left, like in cardiology, GI, stuff like that. They don't really encounter patients that are having other issues in other organ systems that they're having to manage themselves. They may be
Right.
aware of it, but they don't really have to manage it. So I think it's a very different part of, it's weird. It's kind of like you're a specialist as an intensivist, but really it's kind of like you're just a hardcore internist
Yeah, you're a
sometimes.
specialist in really, really sick people.
Yeah, exactly.
So
Exactly.
at what point along your journey did you decide this was what you wanted to do?
I think, it's always interesting to me, right? Because when you're in residency, sometimes it's the people that influence you to do a certain profession, and sometimes it's the job, right? Because sometimes you're in residency and you do a rotation in med school or whatever, and the person is really rude, and you're like, I don't want to do this profession. Or the professor is just the nicest, kindest professor and just very intellectually challenging. And they're the ones that motivate you to do it. And mine was kind of a combination. I became a doctor because I wanted to be a doctor since I was a little kid. I've always wanted to be a doctor since I was about 7 or 8 years old. I knew I wanted to be a doctor. And my grandmother was the person I hung around with a lot when I was a little kid. And I love my grandmother to death, like most kids. I think that just grandma can do no wrong. And I remember going to a doctor visit with her out in rural South Texas. Population 200 was a town I grew up in. And she saw this doctor, and the doctor couldn't speak Spanish to her, and she couldn't communicate with him.
Wow,
And and he and I could, of course, speak English, but he was kind of almost making fun of her because he couldn't communicate with her, like, and getting really frustrated.
that's awful.
And so I said at that point, I'm going to be a doctor, and I'm going to be able to help out my family. I'm going to help out my grandma if she's ever sick. I'm going to be able to take care of her no matter what, And as I moved through school, my goal has always been to be able to help my family with any, or my friends with any kind of questions or anything they have. And so I was always very interested in the other specialties. Like, I loved orthopedic surgery. I loved neurosurgery. I loved both of those a lot. I really liked ortho hand surgery, and because of the technique and the surgery and all that, I love using my hands a lot. And then I loved neurosurgery for the same reason and the complexity of it. Um, but I knew that if I did that, I would never really be able to help my family, like, for critical illnesses all the time. Like, I wouldn't understand the other components. And so I said, really, critical care would be the only way that I could take care of my family no matter what. And the other thing is that I don't like to not know how to do something to completion. And so I said, if I don't do critical care, I'm never going to be able to take care of people to the end that they need to, like, to the moment that we either save them or they die. I want to be the guy who gets to take care of them. And then, of course, critical care had procedures too, and I
That's
wanted to be able to do that.
it's
Yeah.
amazing. Like I don't know that people know what's in your head when you're
Hmm.
on this journey trying to
Right.
figure out what you're going to do. But I that's fascinating that that was your driving factor. I think that's really cool.
Yeah.
And
But
you're that person to me, actually. You're
oh,
the person I called when my mother-in-law was in the ICU, and I'll tell you what I remember from that. I mean, is just you were just very kind. You were kind and you were reassuring, which you always are kind. And I'm so
thank you.
grateful. But you basically were like, look, this is what's expected. This is what's going on. And I'll tell you something that you said to me repeatedly. You said to me through that whole journey is, you're doing great. She's so lucky to have you. And I feel like the part of being a doctor is not just knowing the science, but it's taking care of the people. And so
Yeah.
I'm like, it's a beautiful part. And so it's really neat to hear you say that's where your heart was in your whole journey, because it really shows. So
Yeah. I think just having my grandma as a good example of just somebody who is super kind. I always thought, like, in medicine, we can do all these things, but if we don't touch someone's heart, like, we're not doing anything. Like, we're not helping them out in any way. And so I always said, I try, no matter what situation, no matter how bad things are going, no matter how upset I am or how much I haven't slept, I try to make that person feel like they're the most, hey, like, there's my wife coming in on the thing. That's I try to make people feel like I really, like, I want them to know that I do care about them. And I do. Like, I take these things really personally. Like, it's hard sometimes because, like in medicine, you always try to have to walk that fine line of being, having your emotion in it and then not like over emotionizing where you just like you take it home and then it damages your health and your relationships, or your mental capacity. But I take things that happen with my families and patients very seriously. And I always tell them, like I tell the residents, you treat this patient, no matter who they are, like they're the president. So if you make a decision and you're okay saying this is the president of the United States and I feel comfortable with my decision, then you did the right thing. Whether that be keeping them there at the hospital you're at, sending them out, asking for a consult, or the way you did a procedure. And I tell them, if you don't feel comfortable with that, don't ever do it that way, because you should always train like that scenario. Because if you do that, then when the situation comes that one day you do take care of a very high profile patient, or no matter what you do, you'll know that, hey, I treat everybody the same all the time. It doesn't matter who I don't care, and I worked in Grand Junction. And so I had a lot of, billionaires from Aspen and things I took care of. And it never bothered me one bit, because I'm like, I treat everybody the same. I don't care if you're a billionaire or you're a homeless person, you're going to get the same care from me. You're going to get 100% from what I'm doing, and so I think that's really important to show patients that that's what you have in your heart for them, because all that the medicine stuff, it's not that hard. After a while, you get used to
A
it. You
lot of
understand.
memorization, it's a lot of
Yeah.
repetition. Yeah, I agree with that.
But people are much more variable. That's a chip that, that's a target that's constantly moving. And so you have to know how to acclimate. And even dealing with other healthcare providers, like all your consultants and all that, that's a much harder thing to deal with, as opposed to just the science behind taking care of somebody with sepsis. After you're doing that for a while, you kind of get that down.
Yeah, no, that's beautiful. It's beautiful and I love it. So
Yeah.
you ended up here, right? And are you in the right place? Do you love what you do?
Yeah, no, I think because I had such a broad training in multiple specialties, that allowed me to kind of on my own pick where I wanted to be. And so of course, throughout all my journey, as I went and ended up getting my MBA, because I was always into the business side, and kind of, I felt that's really important, right? Because you can't run a healthcare system without the financial part of it, as being a, kind of a owner operator. And so that was a big part of my journey, was doing that. I always was into business. So I got to tell you this story real quick. So I told you earlier, I had mentioned what was my first job I ever had. So my first job I ever had was when I was about 11 and 12 years old. I started a lawn cutting business. So at that time, I lived in a real small town in South Texas. It was probably population, like I said, 200-300 people, called Runge. And it was spelled like Runge, Runge, kind of close to Corpus and all that area. So my mom used to work at the school, and she was the administrator for the principal, so she knew him really well. So he ended up being my first customer. I asked him, I said, hey, I'm starting a lawn cutting business. I'm going to start cutting lawns. I'll cut your lawn every 2 weeks, and I'm going to charge you X amount of dollars. I can't remember what it was, probably like $10 or less. And that's what I want to do. So he said, yeah, I'll do it. So he was my first customer. So I went out, I would go cut his lawns. I'd actually just walk over, I'd take my lawnmower, push it over to his house. And he was pretty good a whiles away. He's about a mile away or so. And so I would just go, and I've always been super independent as a little kid. Like, I've always wanted to do things on my own. I would figure it out. And I wanted to have my own job. Like, my parents didn't say, oh, you got to work or anything. I just wanted to. And so after like a couple of weeks, he said, oh, well, I'm going to get somebody else to cut my lawns. I got somebody else to do it. And I said, okay, that's fine. And so I was like, was it that I didn't do a good job? He's like, no, no, no. It's just that he's going to do all this other stuff. And I'm like, okay, that's fine. So then about like a month later, he comes back to me. My mom tells me, she's like, oh yeah, this guy's cutting his lawn and he's like messing up his lawn. He's not doing a good job, never shows up, horrible job. So the principal wants to talk to you again to see if he can cut your lawn again. And I said, oh, okay, I'll go talk to him. So this totally characterizes Figueroa right here. So I go back to talk to him, and lo and behold, at 11 years old, I give him my first contract and tell him, I am going to have you sign a contract that I will be happy to cut your lawn, but for this amount of money for this period of time,
Oh,
and you
how
need to give me this much notice before we terminate contract because I want to be sure that I don't have the problems that I had last time. So that's how
little
Figueroa
junior
evolved.
MBA, little
Yeah,
Figueroa contract.
that's how I evolved. And so my mom didn't know about this, that I was doing this. And so later on, she found out and just died laughing. She's like, oh my goodness. She told all her friends, you know what my son did is that he took the principal a contract to make him sign it. He signed it, he's like, yeah, he was all for it. It was like 6 months or a year or something. But that totally characterizes me as a person, like growing up little, like that was just in my head. And so that's how I led, I think, to the MBA. I've always been really curious about
Where in
business.
the process did you do the MBA? Like
I
you,
did it later on. So I did what they call like, they'll hear like executive MBA or so I didn't go back to MBA school like full time. I did it every other week, but I actually did it in person. We had a couple minimal online stuff, and especially with COVID came right when I was doing it. So I finished it in 2020, I think. Yeah, 2020 or 2021, 2020, I think. And it was a 2-year program. And I would go every other weekend, and it was intensive. I mean, it was just you would go and 2 or 3 days of just pure lectures, pretty much like Friday, Saturday. We did lectures all day, and it was good because I was working in the ICU, and so it allowed me to have that time off. And so I scheduled myself so I could be off. And so I'd fly to Colorado. I'd work in Grand Junction, and then I'd work there my week or two, and then I'd fly back, go to MBA school, do that, and then just back and forth, and then just doing my homework in between all of that. And so it was a really good program. It was mostly, like I said, all in person. Um, and it was a lot of people. I think the requirement for that one is that you have to be like already been in working for like 10 years or so. And you have to do all this other kind of stuff. And so, but it was great to meet people that were, it was really cool though, because in that scenario, I had a lot of people, like I had friends that were in financial industry, construction, retail, girl that was the leader for HEB for like kind of all their produce section and all that stuff. So it was really cool because you had a lot of people with real life experiences really working out in the market already, and they
oh,
knew the
it
system.
wasn't healthcare specific. Your MBA
No, no,
was,
no.
it was
No,
just,
and they had a healthcare track in my program, and I did not take it. I was like, I specifically don't want to take the healthcare track because I want to learn globally,
oh,
like about stuff. I don't want to just learn healthcare because to me, that's the stuff that I can just read books and I can tune in into healthcare if I do it. And honestly, the business of healthcare doesn't interest me very much because it's so government regulated that to me it's just like it's very protocolized. And so you just have to, if you have to figure out, okay, well, what's the like what are the KPIs, like the big indicators for like output for like a ICU, like length of stay, how many days on the ventilator, blah blah blah. Those kind of things you can just look up and you figure it out.
I guess I would say for your field, that's really true. It may not be true for all fields, it may not be true
Mhm.
necessarily for mine, but you're working in hospitals, which are highly
Right,
regulated. And so
right.
it's not, you're not
Yeah,
going to come in with your MBA knowledge and really overturn the way they run a hospital, especially
no,
not the critical care part of a hospital. That's gonna be
right.
regulated, that's gonna be protocolized, yeah. So
Right. And then if like someone like you said, hey, come in and help me do X, Y, and Z for my business, well, then I can just look up, like they have big groups, and you just look up and you find out what are all the key indicators for psychiatry for either independently owned insurance takers, non-commercial. You can figure all that stuff out, and the economics behind healthcare. And what I actually did though is I grabbed all the notes from all my friends who were doing the healthcare side. And so really the only difference was that they did their finance and accounting was a little bit different, and their economics, they did a healthcare economics. And I just grabbed all their notes and I would just read through them and kind of like pick up and ask questions. And our professor for accounting also did healthcare, so I could just ask him questions like, hey, I read this stuff and I don't really understand it. And so I was able to pick up on a lot of stuff, but I didn't really want to just like, I wanted to be more with people that were out in the real business, non-healthcare world, because you learn over time that all these things are all the same. They're very similar in how the bones lay. It's like a car, right? Like a car, they all have frames, they all have tires, but just the way you put it together may be a little bit different. And business is all the same. So if you start pegging yourself right away, to me, then you don't allow yourself to grow and learn and see. And I also had the input from all these other people that were in like a friend of mine was a banker in finance, like I said, one is in construction. So they'll tell you like, hey, this is the way we do it. Oh, this is a way we look, our gross margins in construction are 5%. In banking, it may be 10%. In retail, it may be 1%. So you learn all these like cool things about all these different industries all at once. Whereas in like healthcare, you're just pegged in healthcare and that's it.
So did you do that geared toward a career change? Or is it just you want to learn, you want to expand your understanding?
At first I was thinking of maybe it might be a career change, but really what I wanted to do is just enhance myself as a healthcare provider so that I could be more more of an advocate for other fellow physicians was more of what I was looking for. Um, and I really wanted to be able to be a voice for folks so that when we were, because a lot of times I had a lot of medical director roleships and different positions I had, and so I really understood the numbers a lot better. And when it came for contract negotiation, all these kinds of things, a good thing about having an MBA is that you just understand that stuff a little bit better. And so it made it a lot easier to negotiate on behalf of my group or group of people that I was working with, so that people that did not have it, and it was nicer because then I could teach them and be like, hey, look, these are some little accounting things you should know about, and I can give you a book or an article, and guys should learn about these, and I can give them my notes even from class and be like, hey, you need to learn this in the future. And I also do a lot of, I did a lot of, especially when I was in Colorado, a lot of mentorship for nurse practitioners and med students and PAs. And one thing I have not liked in the medical school curriculum is like how we don't get financial education. And it's probably one of the biggest parts on our side because, you see all these guys that are making, quite a bit of money a year and they're like broke. They have like no money. And so I think it's super important that like as physicians and providers, we understand that. And then of course, too, just to be able to talk the talk when it comes to working with now that all of us are being owned, at least in my realm, your realm is very different, but in my realm, almost everybody in the hospital is owned by big organizations now. You got to know that stuff. I mean, you have to know how things are operating.
Let's go in that direction in outpatient care where you have these big
Mhm.
conglomerates buying up small practices and
Right.
consolidating them. And and I don't know. I don't I'm not a big fan of healthcare being for sale as a commodity. I feel
Uh,
like it should be different, but we've seen that over the course of our time in medicine,
yeah.
right? It was more healthcare came in and it's kind of under the nonprofit umbrella and it's kind of federally subsidized, and we went to this insurance model, and now we're really getting into the thick of the business model where the executives, we have another layer of mouths to feed, and it's just driving up the cost of everything because we all
Right.
have business people and executives. Anyway,
Yeah. It's hard because healthcare, from a reimbursement standpoint, from the government systems, Medicare, Medicaid, um, the reimbursement unfortunately is not, as large profit major margins. And so again, now we're looking like, kind of, I was telling you, like in retail, like Amazon, right? It operates on a 1 to 2% margin, or gross margin. Sorry, net margin after profits. It's doing 1%. That's how they make their business, 1%. So you imagine the only way to, there's different business models, right? You either have a low price and high volume, or you have high volume, or low volume and high price, like Gucci and Nordstrom's and things like that. So unfortunately, because healthcare reimbursement is such in that low net margin, you got to have high volume. And so the only way to do that is to conglomerate these systems like Ascension Health and all these other people that have like 115 hospitals now. That's the only way to do it. But then that comes with that is the loss of individualization as a provider. You know, so that's what's been, I think, good from the business aspect to understand that, yeah, some of that's necessary in order for us to continue to function because, overall, yes, our percentage of GDP that we're spending on healthcare continues to rise, and we can't continue to do that.
right. And I mean, like for our business, 90% of our money goes to salaries.
Hmm.
It's not even rent. It's not, you know what I mean? I mean, the biggest cost in healthcare is trying to pay professionally licensed people who went to school until they were in their mid 30s to train for
Right.
the job. And they have, unbelievable amounts of debt to repay and whatever. And it's just like, but in a hospital, then you have a lot of other costs as well. You have,
Yeah. And I think that's one thing that would be cool for people to know, like about this that you were talking about. I mean, I don't know who the audience eventually will be that listen to this all together, but I think what people don't understand is that 16 years of training, that's a lot of lost income for us, coming out
Oh,
of high
yeah, you
school,
have no
you know?
retirement savings at that point, and
Yeah.
you're 45, you have no,
Yeah.
and you're in the
I
hole
was,
for $250,000 if you're lucky. By the
yeah,
time you get there, unless you're just wealthy, which most people are not. I mean, that was certainly my case. That
yeah,
you come out and you have this crippling debt, and you have no,
right. And,
and you have no
and,
home, no, you haven't bought a house, you haven't.
and I think people don't realize either, like during that training, even if you're like a quote new doctor, when I was in fellowship or in residency, you know how it was, like we were on call every third night. And we were in house every other night. I mean, or like in a 3-day rotation. So our hours were about 100 hours a week.
Yeah,
That was my hours easily. And then in fellowship, easily I was 100 hours a week. So I don't think people realize, like, even though I was training for 16 years, or like let's say I was in fellowship for 3 years, a lot of that I was doing 100 hours a week. I was really working like twice that much. So even though I was like working 3 years of fellowship, I had like 6 years of real life experience
yeah,
doing that, and then so when people get mad that they have to pay, $200, $300 for a consult of mine, you got to remember I got in $300,000-$400,000 of debt, and I had no money. I was broke. I had to pay all that myself. And so you're getting a good deal because you're getting like, 30, 40 years of experience of seeing patients. And then, yeah, it's easy to me now, but it took me a long time to get there.
yeah. I think the other thing is physician salaries are not the bulk of the healthcare costs anyway. I know
Right.
people know that either. I mean,
Yeah.
so let me come back to something else you said about the MBA and everything. So like you've done some side projects other than just practicing medicine, and my impression is, but you tell me if I'm right, that you're just trying to entertain yourself. You're not over there necessarily trying to change careers or make a bunch
No,
of money necessarily. You're trying to learn something. You're dabbling at some different projects, just trying to grow as a human being and continue to learn.
exactly.
Yeah.
Yeah, I mean, I think we all have our motivations to do everything in life, right? And me and like I think you're very similar. We've always been similar in that aspect, is that we really do enjoy learning. Like learning is kind of one of our biggest joys in life, and it's one of mine. I
Mm.
love to learn and learn to learn new things. The other thing is kind of like I tell my kids all the time. I tell my kids, you have to create your own career situation. Like you can't just wait for it to fall in your lap and that you're going to get this perfect job and all this stuff, because people are like, oh, I don't like my job. I don't like this. I'm like, well, change it. You got to do something else. And so I've always enjoyed the business aspect. So one of the things that I did for a while, and I still do, is like angel investing, venture capital, things like that, because I've always enjoyed the financing side, because to me, if you see numbers, you really understand a business based on their numbers. And so stuff like that has always made good sense to me. And so I got into working with, when I was in Colorado, with the Rockies Venture Group, and they're kind of basically like their angel group. And angel groups are basically, right, people that are investing in startup companies,
Mm.
and they do different levels of investment. Usually an angel group is starting in those companies that are like baby companies, that they're like what they call like first round companies, stage 1, stage A companies. And then you'd hear about like the KKR and these big companies that are doing like they're throwing in, $500 million, and like we're not doing nothing like that. Um, but it's really cool because you really learn a lot about businesses and how they start off, how they grow, and how they kind of progress. And really, to me, what I've learned is that it's really about people. The people behind a company are what's really going to make it successful. Their model, and whether or not they got the new fancy, like, oh, this gadget's going to help you do this or that. And a lot of the investing I did, which was kind of fun, was in healthcare startup investing. And of course, through our career, we've seen a lot of and we've talked about this a little bit too, kind of the rise of digital health and digital technology in medicine. And so it's been really cool, is that, like, for instance, if they come up with I looked at some of the programs that initially came out, like for sepsis identification. These programs, you put them on the EMR, and if some patient comes in, and they're in the hospital, and all of a sudden their heart rate goes up and they get a fever, and this program will identify, oh, this may be a sepsis patient, and this is what you should do, like, notify the doctor and all this stuff. But what's cool was that from me being on the medicine side, being a critical care guy, I could look at the numbers and look at the finance, but I could also look at the medicine part of it and be like, no, this program is not going to work very well because it's just going to bother people, or it's going to work actually really well. This is really cool, And so it was really cool to be able to see both
Important.
sides.
That's so important because you have a new shiny technology and it straddles these two worlds between the cost, the investment, the output, the what does it do in terms of like you pay this much for it, what does it give you back? And unless you have expertise in both things, you can't assess the whole
Yeah.
thing, right? You can't look at the technology and see if it's medically useful, valuable, makes a difference clinically and worth the cost, economically. That's really interesting.
Yeah, so I did some of that, and then which that led to other things, which has kind of been a springboard. So because I would work with different companies, like for instance, I had one of the gentlemen that I worked with referred me to a pharmaceutical company that they had a product that they were trying to put out, and like when COVID came, they were trying to use that medicine for COVID. And so they asked me to help them go over all their protocols to see what I thought about it in general. Then they wanted to create some protocols to actually put it into clinical trials, and I helped them kind of develop some of those. And well, the guy I worked with was amazingly smart. I mean, he was amazing. He's just a really smart guy. And but what was interesting too, he was very good business wise. Like it's really good to have those both sides. And so I did that, and so that was a cool little springboard to get me to do something like more in the pharmaceutical kind of realm and get to do some consulting work and stuff like that. And then I've done consulting for other stuff. Like one thing I've gotten into lately that I really like is healthcare consulting, just for like wellness for companies. So for some companies though, they're trying to do like now they have all these big programs like Virgin Health and all these kind of like I'm sure you've seen for like employee benefits. You can get these programs or it's an app and you get your do I smoke? Do I do this? It helps with diet. But I don't think those are very personalized. And, often I like smaller companies that are from like, 0 to maybe 2,000 employees, somewhere around there. Um, I think there's a lot of actual benefit because now I think from the critical care side, I see some of these patients so ill. I'm like, gosh, if we could just get to people a lot earlier and have them be a little bit more healthy, and then also be financially aware. So I often help the companies like determine like, are they matching for their employees, like just match for them anyways, even if they're, or just give them a certain amount anyways for retirement. Because a lot of people, there's a huge problem, right? Because our population now is not saving at all. And so the average person that's hitting 65 has about, like 100 and something thousand saved up for retirement. They're pretty much already.
Not enough to, yeah.
Yeah, and I mean because Social Security should be for like the government says really Social Security should be about 40% of your income, but most people are making it 80 or 90% of their income.
Yeah.
So doing stuff like that, I've really gotten into lately and trying that. So you're totally right. Like it's not like my only business because I can do so much better just as career wise being an intensivist, but it's been fun to just be able to branch out, and I think it helps prevent burnout and helps you see things from a different perspective. And like I was saying, you just learn new cool things. And like it's funny, like now I was telling you I live on a ranch now, and so I've gotten so into fixing old cars. Like that's been my new thing. And just doing all this ranch kind of stuff, learning how to build fences. And I have a bobcat now that I've learned how to operate a bobcat. And it's just so fun.
It's so interesting because we sit down, we have this conversation, and this is exactly why I'm doing this, because all the stuff you're telling me, I don't know you're doing that stuff. Do you know what you
Mm,
want to talk about when we talk to each other? Is we talk about our families.
yeah.
That's what we talk about, which is usually what I want to talk to people about, right?
Right.
So you say, how are your kids? What are they doing? Right. And I tell you, and I say, how are your kids? What are they doing? And you tell me
Right.
about the journey into, young adulthood and all this kind of stuff. And so it's really interesting because I had no idea about
Yeah.
all, and so it's neat to hear. And yeah, and I agree. I love to learn. I do stuff. Some of it I'll go and I'll take a course or whatever, and I just want to learn how. Some of it's stressful, some of it's fun. It varies, but what
Yeah.
else you gonna do? You just
Yeah. Well, and I think the problem, talking about careers like this whole podcast you're saying, I think the important thing for people to realize is not to identify themselves with their job. Your job is just a job. and people really, young people coming up, and if they're going to go into medicine, you got to realize that. Like so many people think that like I'm not a doctor, like that's not who I am. To my kid, I'm just dad. And yeah, dad is a doctor is his
Some
career.
people, it is who they are. The
Right.
other thing that I
It's
think is
really bad.
interesting, right, for people as they go through careers is also that, like, I think a lot of because I deal with a lot of young people. I talk to them about their life plan. A lot of them are off track. That's why we're talking. And I think a lot of people think that you're going to go and you're going to qualify for this job, and then that's what you're going to do. You're going to go to school, and that's going to make you into whatever. But your journey is this whole set of unique processes and life events that is very specific to you. It's not the same for everybody. And so there are a lot of other people who might have done the same, gone to the same medical school, maybe gone to the same specialty, but they don't do all these other things that you do. They don't work where you work now. Maybe they went into sleep primarily, and you went more toward critical care or whatever. And so it's just fascinating because I think your journey is such an expression of your values, right? And like who you are as a person. It's not just a thing you qualify for because of
Right.
education.
Yeah, yeah, you really just can't identify yourself with your job. You got to identify yourself as yourself, and what you are as a person. Because right when people, I mean, I'm sure you might see young people, but I'm sure you see older people. When you get older and people retire, they have a lot of big problems with that because they don't know what to do anymore because their job was their identity.
Right.
And if you don't spend that time finding out what you are and what you like and what you don't like, then you have a really hard time. Because me, I don't really care about the money. I grew up super poor, and I could be poor tomorrow and I wouldn't care. I don't care about that. I just want to be doing something. I want to be learning. I want to be growing till the day I die. I want to be doing something where I feel like I'm moving ahead and I'm contributing something to this world and not just being kind of a leech and taken out. You know what I mean?
Yeah.
And and I think if people can identify like what they really enjoy to do and they continue to do that within their profession, then they'll have a great life. And I tell the kids, I'm like, because sometimes, like Mia, my daughter was thinking of going to med school, and she's like, oh, I don't know if I want to do this. And I always tell her, happy people are going to be happy, miserable people are going to be miserable. So you can find joy in whatever you do, whatever the profession is. You don't have to be like, if you're, how in residency is competitive to get into ortho or plastics or dermatology. And if you don't get into that, you're not going to have problems. You're going to do fine. If you end up doing critical care or whatever, you're going to do great. It's like if you can make the best out of any profession, if that's what you want, because it's a profession. It's just a job that you do. But what you have to do is grow as a person, and that's what's going to make you happy in life. The other stuff is just what pays the bills and gets you your house and all that. And so I think if you keep that in perspective, no matter what you do, you're going to be a happy person long term.
Yeah. That's some good advice.
Yeah.
Good life advice. Well, good. This is great. This is great. Is there anything about the journey that you regret? Anything you wish you'd done differently?
When I was younger, I wish I would have spent more time with my kids,
Mm.
because I think I didn't have all this right now. So some of the stuff I'm saying, I don't think I grasped onto. When you're in training, you got to train. And actually, we were really smart, and I didn't have Mia until we were starting fellowship because I told my wife, like, I'm not going to have a kid while I'm this busy. And I know a lot of people
Never
do it, and
did, right?
yeah, and so but when I first went out into practice, I think I was just killing myself a little too much. And of course, you do have to work hard to get started. And then at the same time, you can't be so lax that you're just like want to be off all the time. That doesn't fly either.
And you got this
But
debt, and you got to buy your first house, and you got to fund a retirement account so that you plan for the future, and you got to begin to put squirrel money away for your kids' education. You got to do that all
right.
in your
And
30s.
so but I think I could have spent a little bit more time. I wish I would have spent more time with my kids, or I would have had more time. And I don't think many people don't say that. You know what I mean? um but you do the best you can do. And so I think that was really the only regret I had, because anything I did, like when I was in college, I had four jobs. Like that was because I was so broke, and I went to Baylor, and I was like, oh my goodness, I didn't realize this place was so expensive. And so I worked at a restaurant as a waiter. I worked at the food services at the school, like for my work study. I worked with this guy doing like painting and carpentry and wallpaper. And then I worked at one of the hospitals being a ward clerk because I wanted to learn, like, see the environment of the ER. In each of those jobs, I learned something that has helped me later in life. And that's what I always tell the kids, like, no matter what you're doing, even if you don't like the job, just see what can I learn from this, or the people that I meet, what can they teach me? Because a lot of times, you just learn cool things about people, and friends forever, out of that. So no matter what job I've had, even if I don't like it, I'm just like, I learn a ton of stuff, and all people too will have encounters in jobs in healthcare, especially. You got to watch it because people will try to poke your eyes and they'll try to steal from you. And, like that happens a lot, unfortunately, in medicine. You see it happen. And even those experiences, you learn stuff. You learn about how to be a little bit more savvy. So yeah. So I think it's, no matter what you do, it's, again, if you're going to be a happy person, you're going to be happy. If you're going to be miserable, you're going to be miserable.
That's going to be more important than what you do for a job. It's going to be more important than anything, honestly, to decide that you're going to move yourself toward being a happier person. Okay,
Right.
so then we're going to wrap up, and let me ask you, is there anywhere people should go if they wanted to come and like connect with you, your venture capital, your LinkedIn? Is there, if you want to remain anonymous, you want to hide? What?
I'm on LinkedIn, people, under just Michael Figueroa, so they could definitely use LinkedIn, would probably be the best one to do. Yeah, I'd be happy to connect with them if they have questions or anything about, life and in general, being an intensivist or whatever, or even later on doing rotations or whatever. I'm always happy to have. I've had students come and rotate with me and stuff and hang out. And so, yeah, it's
Nice.
it's it's fun. It's fun to teach people. You learn so much. It's so true when you teach people, you learn just a ton because people always have great questions that you honestly sometimes don't know the answers to right off the top of your head. So it's a lot of fun. But yeah, LinkedIn is always a good way to connect.
Awesome. Awesome. Well, thank you. Thank you for this. This has been great fun. I learned a lot of stuff about your life that I did not know.
Me too.
And this is a great conversation. So awesome. Thank you so much.
All right, you're welcome.